Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NIC VD, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Assalamu alaikum and a very warm welcome to all of you. I am 𝐻𝐚𝐤𝐬𝐭𝐚𝐧 𝐂𝐚𝐫𝐞. After the phenomenal success of the two seasons, we are once again back with the third season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society and powered by Wilson's Pharmaceutical. This remarkable journey of the two seasons would not have been possible without the wisdom, guidance and an unwavering dedication of the esteemed council members and umpires of Pakistan Cardiac Super League. Today we are once again blessed to be in the company of these legends of cardiology, and we are pleased to welcome Professor 𝐏𝐻𝐚𝐬𝐿𝐻𝐬𝐿 Saab, Professor Hafizullah Saab, Professor Abdul Hamid Siddiqui Saab, Professor Rajkumar Saab, Professor Fawad Farooq Saab and Professor Amber Ashraf Sahiba. And the moment for which we have gathered here today, the first match of the Pakistan Cardiac Super League Season 3, which is going to be played between the two teams from the Group A, LNH Pelicans and FIC Fighters. And now I would like to introduce the person whose exceptional moderation has played a pivotal role in the success of this season. And you all are familiar with the name Dr. 𝐏𝐚𝐤𝐬𝐬𝐿𝐻𝐬𝐬 Saab. Without the further ado, I will now hand over the mic towards Dr. 𝐏𝐚𝐤𝐬𝐬𝐬𝐻𝐬𝐬 Saab and will request him to please start the formal proceeding of today's match. Over to Dr. 𝐏𝐚𝐤𝐬𝐬𝐬𝐻𝐬𝐬 Saab.
Thank you very much, Hamza. So we are back again, and this time it is the third season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. It is truly an honor for me to be hosting this league once again, and I think the credit goes to our faculty members, our highly esteemed faculty, along with our umpires who've been there to guide us, and they have actually kept the show alive. In fact, we have grown by leaps and bounds. What a wonderful leagues we've had so far, and this one is not going to be any less. So today It's the first match, and we are going to have our first two teams battling it out. So we have from Faisalabad Institute of Cardiology, fighters, and they are going to be up against LNH Liaquat National Hospital Pelicans from Karachi. So it's going to be Faisalabad versus Karachi, and we are going to be geared up for an extremely high scoring game, although the conditions may be a bit tough. We'll talk about that, but before that I'm going to head towards our panel of experts, and I want to welcome them all, as we have amongst us Professor Tariq Ashraf Saab. Welcome, sir, it's great to have you. We also have Professor Ambar Ashraf. Ma'am, it's an honor to have you on the show. And we have Professor Raj Kumar. Very right. Welcome, ma'am. We have Professor Raj Kumar Saab. He's also there. And definitely last but never ever the least, it is our umpire of the game. He's somebody who's there to keep the things in balance. He's the soul of the show, and this is Professor Mohammad Ishaq Saab. Welcome, sir.
Thank you.
Right, sir. So we do have the two teams, and
Thank you for your kind introduction.
You're always welcome, sir.
Thank you, Hamza.
Very right, sir. It's a pleasure for me to have you all here, our highly esteemed faculty members. And with this now, I'm going to move towards the two teams. Before we do that, I just want to tell you, I think we are all familiar with the game. We have 2 innings, and every team is going to get 10 questions apiece, and the team whichever gets the maximum questions answered correctly is going to win. So with this, I move to the teams, and can we have Faisalabad on the screen? And I will request the captain to introduce his team or her team. Okay.
Assalamu alaikum.
Walaikum assalam.
I am Dr. Sumbul Ali, representing the team of FIC Fighters, and here are my team members: Dr. Wasim, Dr. Kaleem, and Dr. Ahmed.
All right, so fighters, are you ready for the first game today?
Yes.
That's the
Yes.
spirit. Wonderful. Great to have you. And now we move towards the Pelicans, LNH Pelicans. Here we are. Captain, introductions please.
Assalamu alaikum. I'm Dr. Fiza, and I'm having my team members Dr. Basit, Dr. Nada, and Dr. Nimra.
Walaikum assalam. It's great to have you, and it's so nice to see women leading both the teams. Wonderful. So are you geared up? Yes, I think.
Yes.
Yes, obviously, of course you are geared up, and we're going to have a wonderful game. And I will now seek permission from the council, from the faculty members. Sir, do we have the permission to start?
Yes, please go ahead.
All right, sir. So we are going to kickstart this league with the first match. And before that, I think we're going to talk about the conditions. It was raining heavily here. I don't know how things are there, but I do see that there's going to be something in the pitch. I do see some difficulty, but I also expect the teams to score well and play it smartly. So, use your options wisely, discuss amongst each other, and make the most of the time that you have at your hand. All right, so can we move towards the toss, please? So it's going to be an electronic coin toss, and I'm going to randomly ask one of the teams, can we have Pelicans, LNH Pelicans? Do you want heads or you want tails? We can't hear you. Please unmute yourself. Yeah.
I'll choose heads.
They've chosen heads. Can we roll the coin, please? And it's heads. All right, the luck seems to be with you. And now I'm going to pose you with 2 questions. The first question is, do you want to throw the questions or you want to take the questions?
I want to throw the question.
All right, so they've decided to throw the questions. Now question number 2. You will have two scenarios in front of you. Scenario A, case A and case B. Which one do you want to pick?
Case A.
Okay, so you've decided to go with case A, and the news from the center is that it's the Pelicans who won the toss. They've decided to throw the questions and they've picked up case A. Best of luck to both the teams. All right, now moving towards the game, we're going to start with the first scenario. Can we have it on the screen, please? Pelicans, since you are throwing, you'll
Yes,
have to
sir.
read it.
Okay, so a 68-year-old male with hypertension and ischemic cardiomyopathy, EF 35%, presents with persistent symptomatic AF, NYHA class 3, EHRA class 3. He has been on bisoprolol, sacubitril valsartan, apreironon, and apixaban. Despite optimized therapy, he reports fatigue and exertional dyspnea. ECG confirms AFib. Labs are unremarkable.
All right, so fighters, you've got a couple of seconds to gather yourselves and let me know when you're ready. Okay, FIC fighters, you'll have to unmute yourself. Are you ready?
Yes, we are ready.
Okay, so can we have the first question on the screen, please? Pelicans, read the question along with the scenarios. I'll request everybody else to please be on mute. I'll request everyone else apart from the answering team and the team which is going to ask the question, everybody else to be on mute, please. Thank you very much. Please read the first question along with the options.
Question 1. The patient has symptomatic persistent AF with LVEF of 35%, already on beta blockers and sacubitril valsartan. What is the next best intervention to improve symptoms and possibly prognosis? Option A, add digoxin. Option B, refer for catheter ablation of AFib. Option C, increase furosemide dose. Option D, perform AV node ablation. Or option E, start broniderone.
And you will have 60 seconds to answer. Your timer starts now.
Alpha,
Oh,
digoxin.
oh my God, they've just come down the wicket. And is this going to be a Jayasuriya show? I'm not too sure. Are you sure about it? Because 𝐸𝐴c Saab is not going to be happy. He always tells the teams to take your time. You want me to lock it?
Okay, lock it. Yes.
They
Lock
are
it.
saying, okay, lock it. We are confident. Okay, then A alpha it is, right? Lock A alpha. Oh my God, that's not a great start. We have start with a miss. An outswinger whiskering past the outer edge. All right, never mind. So you'll have to play it smartly, be wise about things and make the most of your time. Okay, with this we are going to move to question number 2. Read it, please.
Question 2. Following successful catheter ablation, the patient asked whether he can discontinue apixaban. What is the correct response? Option A. Anticoagulation can be discontinued immediately if sinus rhythm is restored. Continue anticoagulation based on Shadbask score regardless of rhythm. Option C. Stop if LVEF improves. Option D. Stop after 1 month of sinus rhythm. Option E. Stop if anti-proBNP falls below 500 picogram per ml.
60 seconds on your screen. So FIC, you can always go back to the scenario if you want to take a look. Do let us know. And the answering team is supposed to unmute their mics. We want to hear your discussion. FIC, please unmute. Is there a technical issue? FIC, are you there? I think hold the timer because I can't see the... Okay, they're there. FIC, 20 seconds to go. We can't hear you. Unmute yourselves. FIC, we can't hear you. Unmute.
Beta.
Are you sure about it?
Beta.
B beta. They want to lock B beta. Lock it. And yes, well done. Very well played. You took your time, but it's nicely played. Flicked for a 6. Very well done. So FIC, there's just one thing I want to ask you. Please listen to me here. FIC, when you are discussing, once the question has finished, you're supposed to unmute yourselves so that we can hear the discussion. We really enjoy the discussions that you have amongst yourselves. All right. So, moving to the next question. Question number 3 on your screen.
Question 3. After ablation, the patient presents with fatigue. ECG shows sinus bradycardia. What is the most likely cause? Option A, sinus node dysfunction unmasked post-ablation. Option B, acute coronary syndrome. Option C, recurrence of AFib. Option D, dehydration. Or option E, beta blocker toxicity.
60 seconds on your screen.
पोस्ट ओपन ना नहीं तो उसके बाद साइनस नोड डिसफंक्शन ओके हाँ
के बाद और हम लोग उनको क्लीन करते हैं बाद
25 seconds to go. Good length delivery, moving
alpha,
out.
Alpha sinus node dysfunction.
Alpha sinus node dysfunction unmasked post ablation. You want me to log A alpha, right? A alpha?
Yes.
Should I lock it? Yes. Okay, now she's sure. The captain is sure now. Lock A alpha. Yes. You're absolutely right. Very well played. Well done. Great discussion. So it's all about discussing and getting to the right option, right answer, and we all need that at times, and cardiology is all about that. Well done. Moving to question number 4.
What is the target resting ventricular rate in patients with AFib and HFrEF according to the 2024 ESC guidelines? Option A, less than 60 beats per minute. Option B, less than 80 beats per minute. Option C, less than 100 beats per minute. Option D, less than 110 beats per minute. Or option E, less than 120 beats per minute.
60 seconds on your screen now.
आपने पढ़ा
भी नहीं
नहीं केटी ये एफ की वजह से जो कर मिला था 100 है मुझे नहीं आप लोग रिड्यूस तो लेस देन 80 लेकिन अगर दो नहीं कंट्रोल अपने करना
Approaching 25 seconds.
ठीक है Charlie less than 100.
Charlie less than 100. You want me to lock it? C Charlie, right?
Yes, yes.
This one came from the back of the hand of the bowler. Let's see where it goes. Lock C Charlie. Oh no! It was definitely a slow one, and you got too slow on that. Oh, never mind, never mind. Okay, so far we are almost getting midway. Question number 5 on your screen.
Question 5. Which antiarrhythmic drug is contraindicated in this patient due to his structural heart disease? Option A, amiodarone. Option B, sotalol. Option C, flecainide. Option D, dronedarone. Option E, digoxin.
60 seconds on your screen now.
Charlie, flecainide.
You sure about it?
Yes, yes, Charlie.
C. Charlie. She's got a big smile on her
Night.
face. I see a lot of confidence. And let's see whether she's right and the team is right or wrong. Lock C. Charlie. And yes, the confidence was telling the story. Very well played. This one over the covers for a 6. Very nicely played. We really wanted to see a 6. And now you've got 3 6s. So almost midway. 5 questions and you've answered 3 correctly. You can still score good. Play it smartly now. Question number 6 is on your screen.
Question 6. What BP target is recommended to reduce AF recurrence? Option A less than 160, option B less than 150, option C less than 140, option D less than 130, or option E less than 120.
Please start the timer.
नहीं लेकिन वो जब प्रेशर ठीक है ओके डॉक्टर अहमद 120 ओके ऑप्शन E less than 120.
Are you sure about it? E epsilon. You want me to lock E epsilon
Yes,
less than 120,
Yes.
right? Okay, so she's asking all the team members, the captain leading her way. She wants E epsilon, lock E. Oh! That one came in, hit the pads and LBW, I guess. Okay, okay. You were close, but still you were far away. Never mind, 4 more questions to go. And I am hoping for 6s. Big ones. All right, question 7. Please read the question.
Question 7. In AFib with HFrEF, which echocardiographic measure is most predictive of ablation failure? Option A, LVEDD of more than 60 mm. Option B, LA volume index of more than 48. Option C, E to E prime ratio of more than 15. Option D, RV systolic pressure of more than 50 mmHg. Or option E, GLS of more than minus 16%.
And your 60 seconds are on your screen. Both the teams are calculating. Both are hopeful. Let's see.
आरबी से जीएलएस के साथ अब ये टाइम भी उसके वो एलए वाली लगता है कि वो भी आता है
हां ले हम ले
डॉक्टर बजाते वॉल्यूम तो क्लाउड
लॉर्ड होता है ठीक है लेकिन एंड ये तो शब्द
एलबी क्या है ना
लेकिन एलबी की वॉल्यूम इंडेक्स ठीक की है
हां ग्रेटर देन 10
Approaching 20 seconds.
पीछे लग रहा है चलें बीटा LA volume index.
Are you sure, Captain? You want me to lock it? B beta. Yeah, she's saying all right. Not so sure after all. I think one of the team members is quite adamant. Let's see whether it's the right option or not. Lock B beta. And he's absolutely right. Well played. That's the discussion that we want. Good. Great going. So beautifully played, wonderful hitting, and I think we are now approaching a reasonably good score. Okay, so 3 more questions to go. We've done 7 questions and we've gotten 4 correct answers, which gives us a score of 24. We have question 8 on the screen. Read it please, Pelicans.
Question 8. Which physiological mechanism best explains improvement in LVEF after AF ablation in HFrEF? Option A, reduction in tachycardia-induced cardiomyopathy. Option B, shortened QRS duration. Option C, increased coronary flow reserve. Option D, decreased LVEDP. Option E, enhanced ANP release.
And your timer is on your screen, 60 seconds.
ए मुझे ये लग रहा है हमें जब हमारे पास जो होता है ना ईडी वो हमें डायस्टोलिक इंजेक्शन फ्रैक्शन का नहीं पता फिजियोलॉजिकल मैकेनिज्म है बेस्ट एक्सपीरियंस इंप्रूवमेंट ईएफ
मेरे हाँ ये लग रहा है
That's a spinning delivery.
मुझे
I see a leg spinner there. 25 seconds.
एंड कम होता है कम होना चाहिए
15 seconds.
डेल्टा
Okay, so you want me to lock...
डेल्टा डिग्री एलवी ईडीपी
Okay, they are saying lock D delta. Lock it. Oh, another blemish. Another one missed. I did see a lot of flight in the delivery. It was a turning ball and you've definitely missed it. Well, never mind. You can still put up a reasonable score. 2 more to go. Second last question. Question number 9 on your screen. Read it, Pelicans.
Question 9.
Please go ahead. Pelicans, read it.
During uninterrupted direct oral anticoagulant AF ablation, why is heparin given before transseptal puncture? Option A minimizes thrombin burst from early LA instrumentation. Option B improves ACT stability post puncture. Option C prevents air embolism. Option D enhances lesion transmurality. Option E reduces dock variability.
And your timer is on the screen.
हाँ ए एम्बुलेंस में कुछ नहीं करना है एप्रिल में इसका हाँ
That's a bouncer. Let's see how they play this one.
हाँ एसीटी स्टेबिलिटी एक होता है और एक थ्रोम्बिन बर्स्ट हो सकता है तो है उसमें स्टेबिलिटी का मुझे लगता है नहीं करना मुझे लगता है सही है ओके
25 seconds.
अल्फा
You want me to lock A alpha?
यस
Oh, she's saying yes. Confident. Okay, team. FIC fighters, you're fighting it out. Lock A alpha. And yes, very well played. That's beautifully played. Wasn't that easy though, but they've played it very well and they've hooked this one for a beautiful 6 over the square leg boundary. Well done, well done. Nicely done.
चलो
And this gives us a score of 30. So let's see whether we get to 36 or not, because this is going to be the last question of this first innings. Question number 10.
Question 10. A patient with EF 35% has more than 30% atrial wall fibrosis on MRI. Which procedural strategy maximizes freedom from AF? Option A, PVI only. Option B, PVI plus posterior wall isolation. Option C, PVI plus voltage guided substrate modification. Option D, PVI plus empirical roof and mitral lines. Option E, cryoballoon PVI with bonus freeze.
And 60 seconds have already started.
अभी पढ़ा
टीवी सुना था
क्या तो आपको अच्छा
So I do see some reverse swing in this one. Let's see what they end up with.
मतलब उसको ठीक हो गया तो इसके अंदर जो ओनली वाला यही है
मेरे ख्याल
माइट्रल की
में फाइब्रोस
हाँ देखो फाइब्रोस हो गया है उसमें कुछ हाँ ए और बी में एक पोस्टीरियर आइसोलेशन 30% atrial wall fibrosis
15 seconds, come on. Approaching 10 seconds, come on.
alpha
Fighters,
alpha
are you sure? Are you sure you want me to lock alpha? Should I lock alpha?
yes yes
Okay, so there's no other way. We have to lock alpha. Let's see what happens. Lock it. Oh! Definitely a difficult delivery. They tried to negotiate. The discussion was on. Well tried. Very well played indeed. So I think you've done pretty all right. We do have a reasonable score on the board. And with this we come to the end of the first innings. And the news is, and what we've seen is, that Faisalabad Institute of Cardiology fighters have put up a good show. The score is 30 and Pelicans will have to score more than that. All right, so I think another chance for us to talk to our panel of experts, but straight away I'm going to move ahead to our umpire, Professor Isaaq Saab. Sir, your thoughts please.
Thank you very much, Hamza. Yes, it was a good fight that they have given. One or two questions were a bit difficult for their level, I must say, but that's the way the questions are set, and it's your luck, whichever scenario you pick. So I think they have given a good fight, and the score is not great, but reasonable. So let's see how the other team does, and certainly it's a new season that we are starting, and for all the enthusiasm and your excellent moderation, we are going to enjoy. Since the guidelines came into action, I think things have become a little difficult also, because to memorize the guidelines is not always very easy. So I have seen a couple of answers were based on guideline numbers. So I think guidelines have become like a textbook now for us. And this is a message for our fellows and junior doctors that please update yourself with guidelines, because this is the way medicine is being practiced, cardiology is being practiced nowadays. So in short, well done. Keep it up. It's a fight. They have to learn from their mistakes. They have to learn from wrong answers, and that leads to further study, further hard work, and that brings better results. So far, I would say well done, FIC fighters. And let's see how the other team does. Thank you.
Thank you very much, sir. Your analysis always immaculate, to the point. I think you've summed it up well. So they've done well. It's a mediocre total. But having said that, the pitch was difficult and the bowling was also quite difficult to negotiate. But they've done well. They've put up a good fight. So with this, we also have amongst us Professor Rajkumar. Sir, are you there?
Yes, I am there, and I also enjoy the competition is going on. They have tried their best, and as Professor Isaaq says, that they were listening me. Hello?
Yes, sir, we can hear you pretty well.
Hello?
Yes.
So I hope the next team will be in a position to reply and answer the questions in a nice way. I think they have tried their best, but I think it was not a reasonable score to win. So let us see how does the other team compete. And wish you best of luck, LNH Pelicans. Thank you very much.
Thank you very much, sir. It's great to have you with us, and yes, it's going to be a good fight, although the score is meager 30, but we have seen things in this funny little competition. And we also have Professor Amber Ashraf. Madam, your thoughts please.
Assalamu alaikum. Thank you very much. It was a wonderful fight, and the way you moderate, it gives energy to all of us. Especially, I just want to appreciate the team, because the last question is fully related to the EP, and they played very well for that. So keep it up. Just that is the thing, and that's in the way we learn the things. And definitely after FCPS cardiology, the people have to move ahead to a specialty. So it's a good platform where we can increase our knowledge, and we are going to apply that our patient every day. We come across heart failure, either with preserved ejection fraction, with AF, or with reduced. So that's a wonderful thing. Good luck to both the teams. Thank you.
Thank you very much, ma'am. Your comments are always pretty important. I think Professor Isaaq Saab, he wants to say something. Sir.
I just want to add that atrial fibrillation is a very, very common condition, which is often underdiagnosed and missed, you see. So people past their age 60, you will see a lot of them having atrial fibrillation and coming to the hospital with stroke and other disabilities. So I think atrial fibrillation management is a very, very fundamental task of any cardiologist, appropriate AF management, whether it's paroxysmal or persistent. I think with DOACs, life has become much easy now. So AF should not be missed in any case. That's what I wanted to convey my feelings about atrial fibrillation. Because in the past, people thought it's not a very serious condition, but atrial fibrillation is a very serious condition, and you can prevent stroke and other disabilities by appropriate anticoagulation or rhythm control or rate control, whatever the underlying disease is. But I think atrial fibrillation को master करना चाहिए इसकी management को.
Very right, sir. Absolutely spot on. I think atrial fibrillation, we all know it's the most common arrhythmia that we come across, and we as cardiologists and also neurologists, we come across stroke patients, CVAs, and 25% of these cardioembolic strokes are because of atrial fibrillation, and we have seen all that as well. Now we have Professor Tariq Ashraf Saab. Sir, are you there?
Yes, I'm here.
We would like to have your thoughts, sir.
I think it was a very nice presentation regarding both teams did very well, and Professor Saak has rightly said about atrial fibrillation regarding the diagnosis and its management, and especially when to continue anticoagulant, what are the indications according to the international guidelines. So I think this sort of thing should be continued, and many things have been added up, and a knowledge that I added up with me, and thanks to Wilson.
Right, sir. So thank you very much for your input, and we do have the word from the faculty members. And we were taking a break, we were midway, so we've had the first innings, and we know that the fighters, FIC fighters, have put up a reasonable total. 30 is the score, 36 is something that the Pelicans need to go for the victory and move ahead. So let's see how we end up in this game. So best of luck to both the teams. Let's see what happens from here on. So can we have the next scenario on the screen, please? Okay, and I will request the team to read the scenario, please. Fighters.
A 32-year-old woman with no known medical history presents to emergency department with sudden onset palpitations for last 45 minutes. She feels lightheaded but denies chest pain or syncope. Her vitals are heart rate 180 beats per minute, regular BP 115/75 mm of Hg, respiratory rate 16 per minute, saturation of oxygen 98% on room air. ECG reveals a regular narrow complex tachycardia with no visible P wave. Vagal maneuvers fail to terminate the rhythm. Intravenous adenosine is administered, which abruptly terminates tachycardia and reveals signs. She recalls similar episodes occurring monthly over last year, often triggered by caffeine or stress.
Okay, so Pelicans, you can take a few seconds to gather yourselves, and then we will move ahead. Okay, Pelicans, are you ready? You have to unmute yourself. Are you ready?
Yes, sir.
Okay, can we have the first question on the screen? Read the question, please.
What is the most likely diagnosis in this patient? Atrial fibrillation, AV-NRT, atrial flutter, AVRT, sinus tachycardia.
60 seconds on your screen.
Option B.
Sorry, can you say it again?
B. AVNRT.
Are you sure about this? BAVNRT. You want me to lock it?
Yes, sir.
So they've taken a few steps down. They want to play it over long on boundary. Okay, if you insist, lock B beta. And yes, that's a 6 and a beautiful start. Well played, well done. The ball was right in the slot for you and you've heaved it over for a good 6. Well done. Can we have the next question? Question number 2 on the screen, please. Read
What
the
is the
question.
first line non-pharmacological intervention for acute regular narrow complex tachycardia? A. Cardioversion, B. IV beta blockers, C. Carotid massage, D. Valsalva maneuver, E. Breathing into a paper bag.
And your timer starts now.
Carotid massage is follow.
I'll request the answering team to unmute yourselves and everybody else to be muted, please.
Option C, carotid massage.
Okay, you want me to lock C, Charlie?
Yes,
Should I
sir.
lock? Okay, they are saying lock it. They want to cut it over the cover boundary for a 6. Okay, lock C, Charlie. Let's see where it goes. Oh, that's a miss. This one has been caught, got the edge and is definitely caught by the fielder. All right, take your time, as the Saak Saab always says, and be smart about these answers by taking your time that you have there at your disposal. Now, moving to question number 3. Read the question, please.
What is the recommended first line pharmacological agent if vagal maneuvers fail? A. Verapamil, B. Amiodarone, C. Adenosine, D. Digoxin, E. Flecainide.
The timer starts now.
Option C, adenosine.
Okay. Okay, so you want me to lock C. Are you sure?
Yes, sir.
Okay, we are going to lock option C, Charlie. And it's definitely a 6. They've played it very well. This one is definitely heaved over long on for a 6. Very nicely played. A good answer. Well thought out. And with this, I think I would also like to welcome our highly esteemed faculty member. He's also one of the umpires for this league that we have, Pakistan Cardiac Super League, and as he's been in the previous leagues as well, I'd like to welcome Professor 𝐏𝐚𝐤𝐬𝐿𝐴 Saab. Welcome, sir. Okay, we're moving to question.
Thank you, thank you.
We're moving to question number 4.
Which of the following is a contraindication to adenosine administration? History of asthma, pregnancy, age over 60, palpitations greater than 1 hour, normal ECG between episodes.
And the timer is on your screen. 60 seconds.
Okay. प्रेगनेंसी में देखो इनको मैंने दिया है सही है तो डॉक्टर ने कहा था प्रेगनेंसी में दे सकते हैं एज और 60 में भी दे सकते हैं कॉम्प्लिकेशंस है वो तो देना नॉर्मली सीजन में देना तो अस्थमा ही बचा है सही है ऑप्शन ए हिस्ट्री ऑफ अस्थमा
Okay, they've come down the wicket. I see a bit of an AB de Villiers there. They really want to hit this one hard. You want me to lock it? Are you sure?
yes sir
Okay, they are sure. Lock A alpha. And yes, very well done. That's a wonderful 6. Great hit. And they were pretty sure this time around, and rightly so. I think you got this one on a full toss. Well played, very well done. Okay, so with this we have 18. That's the score. 3 correct answers. All right, you're almost halfway. Let's see how it goes. Can we have question number 5 on your screen, please?
During the tachycardia event, which feature on ECG is most suggestive of AVNRT? Narrow upstroke of QRS complex, long RP interval, pseudo R in V1, irregular rhythm, left axis deviation.
And your 60 seconds are on your screen. So I do see some cutters there. Let's see where the ball goes.
Option C, pseudo R wave in V1.
Okay, you want me to lock C Charlie?
Yes.
No second thoughts?
No.
Okay, they want me to lock C Charlie. Lock it. And yes, why would they have second thoughts when they're so sure? Very well done. Wonderful answer. This one was a good one. Very well done. Okay, so you're just 2 questions away, 2 correct questions away from victory. And you still have 5 more deliveries to go. 5 more questions to go. Okay. Question number 6 on your screen, please.
What is the recurrence rate of AVNRT in untreated patients? Less than 10%, 10 to 20%, 20 to 30%, 30 to 50%, greater than 60%.
60 seconds. I think they're going to go for it anyways. I see them launching for a 6. Let's see if they get to the pitch of the ball or not. 25 seconds to go. Approaching 15 seconds. Come on. I think guesswork going on. Come on, 10 seconds.
Option C,
7.
20 to 30%.
You want me to lock C Charlie, right?
Yes, sir.
Okay, lock C Charlie. They're not so sure. Let's see. Oh! They missed by a big margin there. Not sure, for sure. Okay. You're still in the game. You still have 2 more correct answers that you need, and you have 4 deliveries to go. So both the teams have a lot to play for. Let's keep the fingers crossed for both the teams. Moving to question number 7. Come on, Pelicans.
Which ECG feature most strongly suggests typical slow fast AVNRT? Retrograde P wave just after QRS in inferior leads, positive P before QRS in lead 2, long RP tachycardia, flutter waves in V1 to V3, alternating bundle branch block.
And your timer starts now. I think the pitch is disintegrating now. You've started seeing movement here and there.
Option A, retrograde P wave.
25 seconds. So are you sure about it? You want me to lock alpha A?
Yes, sir.
Okay, captain says, all right, go ahead, lock A. Let's see whether they're rightly confident about it or not. Lock A alpha. And yes, this is a great answer. Very nicely played. I don't know how you deciphered it. Maybe you knew it, all of you, but I could hear something coming from someone and I knew it right there and then. That's the right answer coming from someone. Good job. Very well done indeed. Okay, so scores are level now. 3 more questions to go and you just need one right answer. Let's see where we go with this. Question number 8 on your screen. Read the question, please.
If adenosine transiently terminates AVNRT but it immediately recurs, the most likely cause is multiple AV nodal slow pathways, accessory pathway conduction, sinus node re-entry, atrial tachycardia with variable CL, triggered activity.
Timer starts now. 60 seconds are on your screen.
क्या फायदा
25 seconds. Come on, team. 20 seconds. You still
Option
have a lot
C,
of margin.
sinus node re-entry.
Okay, they are saying C, sinus node re-entry. How sure are you about this one? 100%, 50%, 70%, 20%?
99%.
She's saying 99%. Okay, so you want me to lock option C, Charlie, right?
Yes, sir.
Okay, lock C, Charlie. Let's see if this is the winning stroke or not. Lock C, Charlie. Oh no! Goodness!
1% पे गलत हो गया.
1% पे ही गलत हो गया. Oh ho, this was... Never mind, you still have 2 more options to go. You were confident, but somehow you missed it. And, you know, it happens. It happens. All right? So, 2 more questions. You have to get one of them right in order to win here. Okay. Second last question, question number 9. Read it, please.
During EP study, programmed atrial stimulation produces an AH jump and induces tachycardia with VA interval less than 70 millisecond and earliest retrograde atrial activation in low septal RA. Which maneuver best distinguish AVNRT from orthodromic AVRT? Option A, ventricular overdrive pacing. Analyze PPI minus tachycardia CL. Option B, adenosine bolus during tachycardia. Valsalva maneuver during tachycardia. His refractory PVC delivery. Activation sequence mapping alone.
And your 60 seconds are on your screen. All right, let's see where you go with this one. There is some reverse swing now. Okay. Okay.
Activation.
Okay. 20 seconds. Guesswork going on.
Option A, ventricular overdrive pacing.
Okay, are you sure about it or are you guessing?
Guessing, of course.
Okay, she says the team is guessing. Okay, so we are going to lock A alpha, right?
Yes, sir.
Lock A alpha. Oh! You guessed it right! Wonderful! What a guess! What a guess! And that's definitely a huge 6 over the bowler's head. Even they didn't know that it was going to go for a 6. Oh! But very well done. I think they still thought about it. They were not getting bogged down or fascinated by all the words there. They were not getting scared. They used their minds, tested their luck, and they went with the flow. So very well done, very well played. We now have the winners, but we still have one more question to go, and it's always best to go for all the questions because This will help all the teams. This will help your run rates and your correct question percentage, and we all know that we are all here to learn things. So, last question of the match, question number 10.
What is the optimal endpoint in slow pathway ablation to achieve durable success while minimizing AV block? Non-inducibility of MVNRT with no residual AH jump even on isoproterenol. Complete abolition of retrograde conduction. C 20 millisecond. HV
So D was HV interval prolongation of more than 10 milliseconds. E was 𝐏𝐴c AV block during ablation. And your timer 60 seconds, start now.
नहीं करते ना यही तो
Okay, so 20 seconds. Come on, 7 seconds. 6. Just one option.
Option A.
Okay, they are really fond of option A's. Mostly they go for A's and go for A alpha. Lock it. Let's see. Oh! And I think A is really fond of this team. Whenever they go for A, they win it, and that's very well played indeed. This is a wonderful score considering the pitch and the kind of bowling you faced. I think this is a wonderful, wonderful response. Both the teams have done so well on a difficult wicket, but I tell you, it was a wonderful display of knowledge and character and teamwork. Great job. So the news from the center is that we have the winners with us, and it's LNH Pelicans who have won the game. Very well done. Congratulations to Pelicans, but definitely commiserations to the fighters. Faisalabad, you've done very well, and it's all about winning for both the teams. So with this, I think we do have our panel of experts, and I think the team is also telling me, the technical team is communicating to me that they have qualified for the quarterfinals. So well done, very well done. So you're moving ahead. Wonderful Pelicans, great display of knowledge, but at the same time I say, Faisalabad, you will take home a lot of good things. I think you definitely know your atrial fibrillations and arrhythmias more, and we're all learning here. So with this, I move to our first umpire and his thoughts. It's Professor Isaaq Saab, as always. Sir, your thoughts.
Thank you very much, Hamza. Another exciting match that I really enjoyed. Both the scenarios were comparable, slightly difficult, but overall they were equal in balance, you see. Obviously, LNH has played well. Sometimes their guess has really worked better than their knowledge, and that's good luck. They won with a good margin. The other team has also fought well. And as we always tell our junior colleagues and fellows, that it's not a question of victory and failure or losing or winning. It's a question of learning and getting a stimulus from these competitions, which leads us to read more and more and discuss things in depth, you see. So I think overall, the performance has been excellent by LNH Pelicans. They need to be congratulated, and I believe they have qualified for quarter-final, which is another good thing. But at the same time, Faisalabad also should not be discouraged. They have played well, and some of the questions were difficult on both sides. But as we say, Nowadays, atrial fibrillation and EP is a very, very important subject to reckon with. So with this, again, excellent moderation by you as usual, and participation by your distinguished colleagues makes it very lively and very palatable and enjoyable. So thank you very much, and congratulations to both the teams. And my advice is that please don't go with this heart or any discouragement. It is a question of exchange of knowledge and thoughts, and you should keep up with your efforts to improve your knowledge and update on arrhythmias. Arrhythmia is a very important part of cardiology, which needs a little bit of special attention. Thank you very much, Hamza, for an excellent, and Mrs. Wilson. And Hamza of Wilson also needs to be complimented. And the way he was introducing today, he has made a remarkable improvement in his delivery of welcome and presentation. So this lead is making presentation and is grooming speakers of our future cardiology conferences. Well done. Thank you.
Thank you very much, sir. I think your thoughts and your views are not only spot on, but I think there is so much of encouragement that always comes from your side, and I think this has become the catalyst for everyone, and I do see a star in the making. I think Hamza from Wilson is another one that I see, and you're rightly so. I think you've got such a keen eye, very nicely observed. All the credit goes to each and every member of Wilson Pharmaceutical. I think they've put it up so wonderfully well. And with this, I think we also have our other umpire, 𝐩𝐚𝐤𝐬𝐿 Siddiqui Saab. Sir, are you there?
Yes, can you hear me?
Yes, sir, we can.
Okay, I'm sorry having just net problem, but anyway, I just viewed the later half of the competition. Professor 𝐸𝐴c has already summarized the event very well. I thank you, Wilson Pharmaceutical, for having me again as umpire with Professor 𝐸𝐴c, who is a senior cardiologist and a legendary figure in our cardiology circle. Anyway, it was a good revision of the AVNRT. Basically, as already mentioned by Professor 𝐸𝐴c, it's just the exchange of knowledge and sort of comprehension of the knowledge and its dissemination, which is very well done by also and very well moderated by Hamza. Congratulations to you again, with an analogy to the in a way deliveries and shorts and sixes and fours, and hopefully I'll hope the next time I'll sort out the issues and join from the very beginning. Thank you very much.
Thank you very much, sir. It's always great to hear from you, and we are hoping that you'll be there with us in all the games, because your umpiring is also something that we need on occasions, and you've done it so well with us in the previous leagues as well. So we also have other faculty members who have graced the occasion, and we have Professor Raj Kumar. Sir, your thoughts, please.
Thank you very much. As the President of Pakistan Cardiac Society, I will congratulate all of both the teams that they competed very nicely, and this is a healthy competition. This should not be taken that one has won and one has lost. As Professor 𝐸𝐴c Saab is the senior most, and we have been following the footsteps of the seniors, that we should have an academic and a healthy competition among juniors as well. And I congratulate the Wilson Pharma that it's a partner in this academic activities. So I once again congratulate you as well for a nice moderation, and all my seniors and juniors. Thank you for being with us in this healthy competition. Thank you very much.
Thank you very much, sir. It was truly an honor for us to have you with us here. You are an important and integral part of this show, because it's the Pakistan Cardiac Society which has made it possible for all of us, including Wilson's pharmaceutical, and I think you being the president of the society have a lot of role. And yes, academics is the way to go, and we all need academics in our lives. We want to train our upcoming professionals, our trainees, and our future cardiologists, and I think inshallah we'll be doing this with the help of all this effort that goes around by the societies and also by the industry, and this is a wonderful example, wonderful and fine example of that. So I'll move to Professor Amber Ashraf. Ma'am, are you there with us?
Assalamu alaikum. Sure, why not? With such a lovely, energetic commentary, we would love to enjoy all these. Why we leave that? Dr. Hamza, I just want to endorse what Professor 𝐸𝐵𝐸 Saab has explained the things. That's really very important for all of us. And here, I just want to add one thing, like both the cases were really very well prepared from the people who have organized all that. It's a very important topic. If in these type of the activities we involve more PGs from different institutes, at least they can sit and listen all these practical issues, because every day, especially post-COVID, we come across heart failure with preserved ejection fraction, reduced ejection fractions, with arrhythmias. It's becoming more and more common. And that was the wonderful revision of whole of the scenario and the case. That is one of my suggestions from Wilson's Pharmaceutical. When they are going to different institutes, please make some arrangements in the hospitals, in the auditorium, where most of the PGs with their supervisors must sit there and listen that, and they must have their some interactions over there, because that is the best platform where we all can learn, contribute, and go ahead. In the end, congratulations not only to the winning team, but the other team. They played very well. Thank you, Wilson Pharmaceutical, and all the panelists, Pakistan Cardiac Society, to organize such a wonderful show. The other Hamza, who has organized all these things in very nice way and motivated all of us to come and participate. Salute to all of you. And thank you, Dr. Hamza, for wonderful commentary. I love to learn the style what you are doing. Thank you very much.
Thank you very much, ma'am. I think it's always great to hear your comments, and this keeps me going, keeps everyone going. It's always great to listen to these comments, and we all try our best. So thank you very much for gracing the occasion once again, as you've always been there for all of us. Thank you. And I think we also have an announcement to make, and the team has just told me that from the next match onwards we will be having some kind of a QR code which can be scanned by all those people who are watching us from their phones and their tablets or their computers, and they'll be able to join and participate in the questions. So we'll roll out the details as the things unfold. So we are now expanding, we're bringing in new scenarios, we are bringing in more options, and as I told you, this league is growing, and the credit goes to all those people who are actually working behind the scenes. So I think I think we have the teams there, right? Can I have them on the screen, please? Okay, 𝐸𝐵𝐸 Saab, I believe you are there and you want to say something.
I just want to endorse what Madam Amber Ashraf has said, that this kind of interaction should also benefit people not sitting only here, but sitting elsewhere and listening to the whole proceedings in their hospitals, in their lecture theaters, wherever they are. So the link should be made available to them and to the PGs, and wherever they are, whether they are driving or they are sitting in their home, they can benefit from this interaction. I think this is an excellent way of learning on these matches, about the scenarios and about the answers which are given. So I think everybody can learn a lot rather than going on to the textbooks, which is quite difficult. This is a short way of learning modern cardiology. That's what I just wanted to add.
An extremely important point
Thank you.
yet again by Professor 𝐸𝐫𝐞 Sahab. I think this is something that we have to work on. I'm sure the technical team is working on that. We've been talking about it because this is going to be learning on the go for them, whether they are in their wards, their hospitals, at home, driving. They can listen to this, they can see these, they can participate in some way, and in this way they'll be taking home a lot, and this will then in turn prepare them for their exams, and I think for their clinics and their ERs and patient interactions. So this is what it's all about today. I think this was arrhythmias made easy for us. Wonderfully done. So can I have the two teams? Okay, so the winning team, we have it. We have them in front of us. So we have the Pelicans. Pelicans, your thoughts?
Yes. Thank you for this opportunity, and it was a good match, and best of luck for our opponents too for their future endeavors.
Okay, so best of luck for all the matches that are going to come your way. And I think I also wanted to take on board the Faisalabad Fighters team. I believe we don't have them there. I would have taken their thoughts, but definitely I think both the teams, it was not just one team. The Pelicans have won on paper, moved on, but Faisalabad, FIC Fighters, they fought very hard and they are also winners today, and I think it's winning streak for everyone. We are all going home as winners, and this is what this league is all about. This is what this concept is all about, to improve, learn things and be the best at what we do. Thank you very much. I think with this we are now coming to the end, and I'm going to sign out. Until next time, Allah Hafiz.